Hello, everyone. This chapter, we're going to be talking about specialized patient records. So thus far, most of the things we've talked about has been just like your standard health information. There are certain categories of health information that require special attention or special treatment, so to speak. We've touched on these a little bit, but this would be things like substance abuse or mental health treatment, anything in non-acute care settings, such as in the patient's home or therapeutic treatment. These are all subject to different legal requirements than your typical health record. Okay. Like I've said before, generally most legal questions about health information aren't answered by federal laws, but by state laws and regulations. Drug and alcohol abuse treatment is one of the exceptions to this. There are two federal laws: the Drug Abuse Prevention, Treatment, and Rehabilitation Act, which addresses drug abuse patients' records, and the Comprehensive Alcohol Abuse and Alcoholism Prevention, Treatment, and Rehabilitation Act of 1970. That one addresses alcohol abuse patient records. Both of these laws give the Secretary of Health and Human Services the authority to make rules and regulations for these types of records that apply to any treatment program that receives federal assistance. So this would be a facility whose only purpose is to provide alcohol or drug abuse treatment. But it also includes general medical facilities if they have an identified separate unit or specific staff that is designated to deal with drug and alcohol abuse diagnosis and treatment. Okay. The regulations for confidentiality are much more strict for these specialized records, and we've touched on this before as well. The regulations restrict the release of any patient identifying information, including not identifying in any way the patients that they treat or have treated. It does not prevent them from disclosing that a person is not and never was a patient. So if someone sends in a request for information, they are able to say, we have not treated this patient, which, to me makes it kind of easy to figure out if a patient was treated for drug or alcohol abuse. If the facility doesn't tell you that they were not treated there, then you can deduce that they were. Anyways, so because of this, each of these types of facilities should have a method in place for how all of these requests should be answered. All patients that are treated in these programs have to be given a notice of the federal confidentiality requirements at admission or very soon after. This patient notice has to include a written summary of the federal law and the regulations. Each program can develop their own notice or use, there's an example that is provided. Whichever they use, they have to just document in every patient's health record what time frame the notice was given in order to be compliant with the regulation. Federal regulations governing the disclosure of patient information fall into three categories. The first is disclosures made with written patient authorization, if the patient gives that written consent. The second is those made without written authorization, but pursuant to federal regulation. And then those made subject to a valid court order. Okay, so let's go into more detail of each of these. For disclosure with written patient authorization, the release of information form has to have the name of the program or person that is allowed to make the disclosure, identification of the patient, name of the program or person that the disclosure can be made to, like who can receive the records, what's the purpose of the disclosure, the amount and type of information to be disclosed, so from this date to this date kind of thing. Signatures of the person authorized to consent, which would typically be the patient if they're a competent adult. Notice that the authorization may be revoked and the expiration date. Okay, who can authorize disclosure? This is the same as what we've already learned, like I just mentioned, an adult patient that's competent, and a minor unless the state law requires a parent or guardian to sign. This form has to conform with federal regulations and have all the required elements because if it doesn't, it's considered invalid. Okay, federal regulations strictly prohibit redisclosing the information, meaning the person or facility that receives the information cannot release it to anyone else. In this scenario, the regulation doesn't allow each facility to develop their own notice. They have to use this specific statement that is listed in the regulation, and it has to accompany the health record, go with it when it's released. So every time you release this type of information, it has to have this notice prohibiting redisclosure. On top of that, facilities can choose to also stamp each page saying that the information cannot be redisclosed. So if you're a facility that receives information, like specialized information about one of their patients, if someone comes and requests information from you, you cannot send that information with the other records you're sending. Hopefully that makes sense. Okay, moving on to the second category, disclosure without written patient authorization. Because of the sensitive nature of this type of health information, there are very few exceptions that would allow release without the patient's signature. The first exception applies to medical emergencies. Patient identifying information can be released without consent to medical personnel that are providing emergency treatment, which would be treatment for something that poses an immediate threat, requires immediate medical attention. An example of this would be if a medication was incorrectly labeled or packaged. If there's reason to believe the patient's health would be threatened because of this mistake, then their health information can be disclosed to the FDA, and so they would notify the patients and their doctors. Anytime this does happen, it has to be documented in the patient's record, stating who disclosed it, who it was disclosed to, the date and time, what the emergency was, okay, all of that type of stuff. The second exception is for scientific research activities that meet specific requirements. The treatment program has to approve the researcher and what they're using the information for, and that to make sure that there's also a protocol in place to maintain the security of the information. And of course, it cannot be redisclosed. The last exception is for audits of patient-specific information by qualified organizations or individuals. And the same thing applies here. They cannot redisclose the information. They have to destroy anything with patient-specific information after the audit is done. Okay. All right. On any given day, a health information manager at a substance abuse treatment program can receive a discovery request, or a court order or subpoena, or any combination of these for a variety of reasons. So let's review. We're going to talk about, again, the differences between these three legal processes. A discovery request to produce a health record seeks disclosure of patient-specific information to be used in litigation. And a subpoena or subpoena duces tecum is a command to appear and or present documents and other things in court. It does not authorize disclosure. And then a court order authorizes this disclosure. Next slide. That would otherwise be prohibited by statute and regulation. Okay, so this has to accompany the discovery request in order to disclose the specialized information. These court orders are only issued if there's good cause, and like there's no other way to get the information, and the public interest or need outweighs the impact on the patient. So it's not very easy to get. So if, say, a police officer shows up with a subpoena without a court order, you cannot disclose the information. Or if an attorney comes in with a discovery request without a court order, again, for this specialized health information, you cannot disclose the information. All right. In order for the court order to be valid, it has to limit disclosure to essential parts of the record, like specific parts. It can't just say the whole thing. Limit disclosure to persons who need to know, and include measures to protect the patient, like sealing the records and things like that. Okay. So the health information manager should have a litigation response plan in place, which we've gone over before. So that includes the policies and procedures for how to handle all these types of situations, instructions to contact the attorney after receiving just a subpoena to let them know what the regulations are, and how to handle court appearances. Okay, we've established that federal law directly regulates substance abuse records, but the regulations recognize that state laws are also going to play a role in this. State law can be equal to, more restrictive, or less restrictive than federal law. Remember, you always follow whatever the stricter law is. In some cases, it'll be state, in others, federal. It just depends. Also, if federal law doesn't specifically address something, then you follow state law for that issue. And there are some laws that have overlapping issues, but they don't match exactly. So again, whichever's more strict will apply. Now, what happens if a treatment program closes or is acquired by another program? According to the regulations, the patient has to give written consent to transfer the record. If they do not give this consent, you have to purge or destroy any patient identifying information, unless the statute of limitations requires you to keep the records for a period beyond, the closure or transfer. If the patient does not authorize transfer, but the records need to be kept for a period, you have to place any paper-based records in a sealed envelope or a sealed container, and label that it has to remain confidential until X date, under X regulation or statute or whatever, and then can be destroyed after that date. Any electronic records have to be encrypted so that they cannot be accessed at all. All right, a big reason for these regulations being so strict is that people seek this type of treatment, or the people that do seek this type of treatment are not more vulnerable because of the availability of their record, than people that do not seek treatment. Because of this, there are penalties for any violations. The regulations assume that all federally assisted substance abuse programs will comply, and any violations can be reported to the U.S. attorney of their district or the FDA if it's a methadone program. If convicted for a first violation, you can be fined $500 and up to $5,000 for any subsequent offenses. So this is kind of one of those things, you can't plead ignorance, like, oh, I didn't know, that won't count as a defense. You would still get those fines. Okay, moving on to mental health and developmental disability care. There are several settings that people with mental illness or developmental disabilities can be treated at. Inpatient psychiatric hospitals, residential treatment facilities, and therapist offices are the most common. Legally, these types of records are treated the same as general health records, except for two things. There are additional requirements for record content and more stringent privacy requirements. Okay. These types of health records can sometimes have things that aren't in general health records, such as changes in the patient's supervision, which is like seclusion, use of restraints, passes, and discharge. Significant legal events, so commitment orders, like if someone's committed against their will, or if there's like an interaction with the police, and then suicide attempts. All of these types of situations have to be properly documented in the health record, but this is not in a typical health record. Okay, so there's going to be some differences in how you handle that information. Any psychiatric facilities that receive Medicare funds are governed by the Medicare Conditions of Participation. These regulations list the standards for documenting any assessment and diagnostic data. Also, psychiatric evaluations, treatment plans, how to record like patient progress, discharge summaries, all of that. Most of the time, state mental health codes also have documentation requirements. These can require written plans for each patient, like documenting if there's restraint use, limitations on patient rights, any special treatments like electric shock, etc. Okay. On top of the state and federal requirements, Joint Commission also has documentation requirements. So we have all of the standard requirements, and then Joint Commission requires documentation of the patient's legal status and any involvement of family members in the patient's treatment program. The other main difference from a general health record is the fact that there are two separate records. So there's the official or public record that the treatment facility will maintain, and then the personal record maintained by the clinician. So the official record has everything necessary to document the patient's care and treatment that is required by law. The personal record has all of the clinician's notes from like all of their conversations. So these are not legally required. The personal record is not legally required to be part of the official record. In fact, it's not even legally required for there to be a personal record. This is mainly just for the clinician's use. And so because of that, it's not subject to discovery. Okay. Like with substance abuse treatment, facilities that offer mental health and developmental disability treatment have very strict confidentiality requirements. They cannot disclose if someone is, was, or will be a patient at the facility without the patient's consent. Same with release of information. You have to either get the patient's consent or there has to be a court order. Okay, moving on. Like we talked about with privacy and confidentiality, there's no one comprehensive law that addresses the legal requirements for home health care. You have to look at all of the requirements, state law, federal regulations, accrediting standards like from Joint Commission. And if they receive Medicare funds, then you also have the Medicare Conditions of Participation. Okay. These conditions will also detail qualifications for staff and the rights of the patient, the notification to patients of their rights, confidentiality of all clinical records, and then advise patients of disclosure policies and procedures. Okay, most state laws follow the Medicare regulations and include all of the confidentiality and disclosure information. Some state-administered Medicaid programs, have specific regulations for home health care agencies. For example, Tennessee's licensing regulations for home health also details what has to be included in the record, what the retention requirements are, and then security safeguards, okay? If the state doesn't have specific laws or regulations addressing home health care, then the HIM manager can look at county requirements, which is usually issued by the county's Department of Health or Social Services. Okay. Even though accrediting standards don't have the force of law, they can be used to establish the proper standard of care in negligence cases that are brought against the home health agency. Okay. Joint Commission and the Community Health Accreditation Program both have standards for community-based and hospital-based organizations that offer home health services. So the health information manager has to be familiar with all of these things, okay? Another type of specialized patient record is that's involving genetic information. Unlike mental health or substance abuse, genetic information is not kept separate from the general patient record. So there's the risk that more people, nurses, hospital staff, could have access to the information. So genetic information would be any information about someone or their family that is obtained from a genetic test of someone's DNA. Unlike most health information that looks at someone's current health or past issues, this is a look into the patient's health future, okay? We've already talked about the Human Genome Project, but a quick refresher. This was funded by Congress, and the goal is to map and characterize each human gene. The research material is available to the public on the project's GenBank website, so if that interests you, definitely check it out. The intention is that doctors can use the research material to assist their patients by trying to detect if someone has a gene for a disease that hasn't manifested yet. They can then increase diagnostic surveillance to try to catch the disease early enough to increase the patient's chance of survival. It can also show if someone is a carrier of a gene for a specific disease that can be manifested in their children. Okay. Since this information is made public, there are a lot of regulations in place to prevent people from misusing it. HIPAA prohibits insurance companies from considering this genetic information. So a possibility that they could have a disease in the future based on a certain gene, they cannot consider that a pre-existing condition. And then charge higher premiums based on that. Okay, they are not allowed to do that. There are also executive orders at the federal level that prohibit federal agencies from using genetic information to make decisions of hiring or promotion, and they're not allowed to request or require genetic testing from their applicants or their employees. Several states have also passed laws about this, prohibiting genetic discrimination, okay? All right, so because there was some misuse of this information going on, Congress passed the Genetic Information Non-Discrimination Act of 2008. So this strengthened the safeguards that HIPAA and state laws already had in place, specifically addressing employers and insurance companies, okay? The last type of specialized patient health records would be HIV information. AIDS is one of the most pressing public health threats currently. I think right now they estimate that 1.1 million people in the U.S. have HIV, which is the virus that develops into AIDS, which has no cure and no vaccine to prevent it. So a little background information. HIV is a retrovirus that attacks and suppresses a person's immune system. It's transmitted in a limited number of ways through sexual contact, exposure to blood or blood components, or passed from mother to child, either in utero or even through breast milk. And the disease can progress to AIDS and lead to death. There are federal and state laws that address the testing requirements and confidentiality concerns regarding this type of patient information. There are a variety of tests that have been developed to try to detect the HIV antibody and antigen. The most commonly used is the enzyme-linked immunosorbent assay, or ELISA. This detects HIV in serum or in plasma, and if it yields a positive, it has to be confirmed with a second test on the same specimen. There are a few options for the secondary test: the Western blot assay, radio immunoprecipitation assay, or RIPA, and the indirect immunofluorescence assay, or IFA. Okay, once it's confirmed by the second test, the person is then considered seropositive for HIV. Obviously, it's very important to keep these test results confidential. I think that goes without saying. Most of the HIV testing in the U.S. is voluntary. Okay, voluntary testing encompasses 3 areas. 1, the person has consented to testing, which requires written, informed consent before they're able to start the testing. 2, delivery of pre-test information and counseling. So state laws require the doctor to give certain information to the person before being tested that goes over the different test types, the methods, the meaning of the results, and then to talk about how the disease is transmitted or how to reduce the risk of transmission. And the last thing is disclosure of results, called post-test counseling, where they go over the test results. They talk about methods to reduce the spread, how to notify their partner. They also give information about support groups, and if it is positive, the doctor is required to notify the appropriate public health authority. Now, mandatory testing is a forced testing, so the person doesn't have the right to refuse. So this would have to be court ordered if they determine that there's very convincing evidence that the person is infected with HIV and is a threat to public health. This would only be for certain groups of people that could threaten public health, so prisoners, convicted sex offenders, okay? Some states allow employee testing on a voluntary basis. Other states prohibit it completely. It just depends. A lot of people choose not to get tested just out of fear of testing positive and facing discrimination. So to try to get more people to get tested, some states have passed laws allowing people to get tested anonymously. So each person is given a unique identifier, kind of like a coding system, that would replace their name on all forms and blood samples. Then that identifier is reported to the public health authority, not their name. Anonymous testing is not allowed for testing to see if you're eligible to donate blood or other tissues, though. Your name has to be included with that one. And that is it for today. So let me know if y'all have any questions, and I'll see y'all next week.